tell you, as I read through your questions, each one of those questions could be a half an hour conversation on its own.
Yeah.
Okay.
We try to get as detailed as we could.
Well, it was very detailed, and that's without the backup questions. So
Okay.
um, you may have to tell me to be more succinct if you think I'm talking too much.
Sure. We could also reduce the questions if necessary. It's not a
Okay.
big issue.
Okay. Okay. Tell me what you want me to do.
Okay, so I can just open up and start talking about Clarity Reach. So I found it with my family about maybe a year and a half ago. And originally, I started it as some sort of website for like information on myopia that could be easily accessible to parents while also answering potential questions that children might have. However, now I'm kind of seeing it as more than just a website and more of a movement for myopia awareness so that people can better understand what myopia is and how, I mean, as we all know, it's more than just needing glasses, that it's a world health crisis.
So there's so much in what you just shared, and so much has changed over the past decade. Um, I will introduce myself first so you know who I am and where I come from.
Mhm.
My name is Sandra Block. I am an optometrist. I graduated from the Illinois College of Optometry in 1981. Very different time for eye care than it is today. I have pursued both a master's in education as well as a master's in public health because the education piece focuses on the needs of children,
Mhm.
which as an optometrist I didn't know or understand, and the master's in public health because, as you've just said, myopia is a global problem, and we really need to look at it from a very different perspective instead of just me and my patients in the clinic room. So that being said, I actually, at the last part of my academic career, because I was an educator for 39 years, I was overseeing a clinic in the Chicago public school system where we had 15 exam lanes providing eye care at no cost out of pocket for children within the Chicago public school system. So it's a combination of the education, the public health, and as well as the education of my clinicians, because that was what was important. You want to make sure the people you go to understand the needs of children. So, a very important part, though we don't, patients walking into their clinics won't think about that. They just assume everybody's comfortable and knows what kids need. So, with that, I retired during COVID because it was a school and the schools were closed. And I became active in the World Council of Optometry. The World Council of Optometry represents optometry around the world. And that's important because, number one, optometry is a relatively new profession. Ophthalmology has been around for many years, but
Mhm.
the field of eye care has gotten very complicated, and more clinicians are needed to be able to provide care, especially in low and middle income countries.
Yes.
With that, the World Council of Optometry, also referred to as WCO, represents the profession within the World Health Organization. And that's an important piece right now because in 2019, the first report on vision came out of WHO. Within that
Mhm.
report, we found out the things that were causing the most reduced vision. And the top two were uncorrected refractive error, which they
Mhm.
included hyperopia,
Yes.
myopia, astigmatism, and presbyopia, which is the problem when you reach around the age of 40 and you have trouble seeing up close, as well as cataracts. Those are the two biggies. And the fact is that at that time, myopia was just looked at as strictly an optical problem. So for those who don't understand myopia, the idea is if you have good vision, the information you're seeing comes into the eye and focuses on the retina in a nice clean image. In myopia, the eye is too long and results in a blurred image. So We understand the optics of myopia and realized it for years. There have been data that's come out looking at the prevalence of myopia worldwide. As a matter of fact, Brian Holden from Brian Holden Institute down in Australia, they identified that the problem of myopia is becoming epidemic. And if
Yeah.
you look at some of the data from the Asian countries, such as China as an example, children in high school, almost 80% of them are myopic. So this is a serious problem. Now, that's the first piece of this as an epidemic. The second piece is there have been studies that have come out, mostly from the Asia Pacific countries where myopia is a bigger problem, that say myopia in childhood is an optical problem predominantly, but as you get older, if you are moderate or high myopic, you are at risk for a multitude of different vision threatening conditions that are not correctable, that are eye health problems. And that's why the National Academy of Science, Engineering, and Medicine in 2024 came out with a report that said myopia is a disease and not simply a refractive error. So that's more than you probably wanted to know about an introduction, but that kind of leads into why myopia is so important.
No, thank you. That was a great rundown. And like you mentioned, the global epidemic is a huge prevalent issue. When we spoke to a few doctors in China, they also illustrated this point as well, mentioning how, especially in young children and older individuals, myopia tends to get worse if it's left untreated. So I think it's important to address it as an illness.
And we're learning more each day on myopia because there's more and more studies coming out of the various interventions. How often should we see a child before the myopia develops? That's always the question. Is there family histories of myopia or high myopia? So, for example, I was a high myope. My children, both my adult children, are myopic and a significant amount. Now I worry about my granddaughter, who's going to be 3 in November and is a low hyperope. Some of the early studies are saying we need to start to look at prevention
Yeah.
before the myopia develops. And
Mhm.
that's where parents need to be aware early on.
Gotcha.
Yeah, I think that's very important. I wish more parents kind of understood these things about myopia. I know for a fact, as a child who grew up with myopia, that my parents didn't, I guess, fully understand the connotations behind their child having myopia, which I don't think should be blamed. It's more like I wish there was more information. So I guess for my question, what is one thing you wish every parent understood about childhood myopia and long-term eye health?
Oh, so I might even step back a little bit longer and say vision is part of the body and very important for a multitude of things from birth on up through old age. It is important because children learn by modeling and watching. So any child that demonstrates difficulty in looking at things or in getting right on top of the television or devices, sometimes it's hard to pick those up for the lay parent, the one who doesn't have that knowledge or background, but it's
Right.
really important. That being said, they need to be educated about the importance of vision in overall development and that it starts early. A child's first eye exam is usually in the hospital at or wherever their birth is, and looking to see if the child actually appears to observe anything in their surroundings. Definitely blurry in the first year, gets better by 12 months, but usually you can tell if there's a very significant eye health problem.
Mhm.
Typically, there is, the hope is every child would have an eye exam, on a regular basis. The American Optometric Association talks about one in the preschool years and then annually in school. Other
Mhm.
places have different recommendations for how often a child should have an eye exam. But the reality is there are not enough eye care providers around the world for every child to get an exam every year. It's just not realistic.
Yeah.
So with that, we need to integrate good quality screenings, vision screenings in programs. And that does a couple of things. Number one, it teaches parents that vision is important because screenings are required in many places. I think there's a bit over 30 states require vision screenings these days.
Yeah.
The problem is the screenings in the states vary as to what they're doing. So they're not all equivalent. The other thing is that a screening is often misrepresented as an exam. Just because a child passes a screening doesn't mean there's no vision problem. The likelihood is if a child passes a screening, there's no myopia present, but there may be other problems like hyperopia or farsightedness. And oftentimes vision screenings will miss that. The new instruments that are out there for vision screenings are better than they used to be, but there's also, nothing's perfect. Just like
Yeah.
just like anything we do, it
Mm.
may be 75, 85% effective, but there's always that 20% that gets missed.
Yeah.
So an eye exam is not replaced by a vision screening, but a vision screening may be a tool to get more people who are at risk into the eye doctor.
Gotcha.
Yeah, I'm really glad you touched upon how important the vision screenings are in the fact that you just need to get someone into the eye doctor. I think that's a really important like takeaway. Um, so how can uncorrected vision problems, you touched upon this early on, how can they affect learning, reading, classroom performance, and confidence in school-age children? I know, at least for me when I was a kid, I was sort of unaffected by it, at least in regards to my academics, but I'm wondering how it affects like other children.
So it varies on what the problem is with myopia. And if you have a moderate to a low amount of myopia in your academic years, you usually see pretty well up close for reading and doing things within a reasonable amount distance. It's the moderate to the high myopes that the problem becomes more challenging because they can't see the board. And how many kids do we know that do not want to be in the front seat?
Yeah.
That's what oftentimes teachers will do. They say, "Oh, you're having trouble seeing the board, we'll just move you up front." That isn't necessarily a good thing for a child's confidence. Um, it may help them. I have to tell you, I had a family come into one of our clinics. uh, Two girls were high myopes, and what they did is they snuck their phone in to the classroom and they take a picture of the board so they could look on their phone for what was on the chalkboard or the black whiteboard. You know,
Yeah.
I'm dating myself obviously by saying chalkboard, but children are really good about finding ways around the problems that they exist, but they
Yeah.
shouldn't have to do that. There should be a mechanism that identifies who is at risk. Now, if you are a higher amount of nearsightedness, or you also have astigmatism, or you have farsightedness, things up close can be blurry. That means you may misrepresent what you are reading or misread that and not understand the text that's there. Now, certainly in kindergarten, first and second grade, the text is usually pretty large. But as you get older, in third grade, that's when you transition from learning to read to reading to learn. And at that point in time, if you're having trouble seeing the text because the font starts to get smaller, you might demonstrate some delays in your academic performance, not because it's not capable up here, but
Right.
because they're not seeing well. So
Yeah.
it's it's really important for educators, teachers in the classroom, parents to watch closely if a child is doing their work and look to see what they're doing. Some kids have double vision because the eyes are not postured together. If they see a child covering their eye or turning their head, those are indications that there's a problem. So to
Yeah.
me, the education for teachers should include what to look for in a child who may not be performing at the level that you'd expect them to perform.
Exactly. That's a good point to like keep educators aware and helping identify the problem. It's not just the parents' job, it's everyone, the whole village needs to
Exactly.
have an input.
Exactly.
I agree.
I spent 25 years working with Special Olympics. We created a vision problem along with seven other disciplines,
Wow.
looking at hearing and some other things. And what we found oftentimes is there were children with special healthcare needs that were
Mm.
identified as having a lower capability just because they needed glasses. Myopia is a very common occurrence in many of the syndromes or other systemic problems, such as early birth, low birth weight. So
Right.
those are other things to think about. It's not just the child in the regular classroom, it may be also the children in special needs classrooms.
Of course.
Yeah, I know when I was a kid, I would just ask to be moved to the front of the class so I could see the board easier. But I know some of my friends who now I know have myopia were too like embarrassed to do that. So I think it's interesting how even when the solution to others may seem easy, like, oh, just ask the kid can just ask to move to the front, it's a lot deeper than that.
The other problem is children in school, and I don't know, Camden, if you were active in sports, but oftentimes myopes have more trouble doing sports like basketball or soccer or other things. Yes, there's sports glasses available, but those cost money and they are
Yeah.
not always covered by the insurance.
It's
Contact lenses, in my mind, contact lenses are a very appropriate consideration for people who play sports. Sports goggles are good for contact sports, but I have to say, I sat on the sideline of soccer games from the time my daughter was in kindergarten through high school, and I saw parents tell their kids to take their glasses off before they went on the field for safety. And it's like, wait a minute, safety for the glasses or for the
yeah.
child? But there was, parents don't understand the importance or the value of those things, and they don't know what the alternatives are.
Right.
Yeah, about a funny story about that is because of my glasses and how they impacted my sports, I ended up choosing swim as a sport because to me I was like, oh, half the time I'm gonna have my eyes closed, and that I realized like you have the goggles on most of the time. But for me, it was the one that I felt was least impacted by my myopia. So I found that one to be the most enjoyable sport. But yeah, it definitely affected me when I was younger and I was like playing with other kids, having that illness.
I think that that is such an important component to hear from you. I could talk till I'm blue in the face, but hearing it from you is much more meaningful.
Thank you. So for my next question, as president of the World Council of Optometry, what did you learn about childhood myopia that most families in the United States might not realize, or I guess just around the world?
So the interesting thing is the period of time that I was the president was a time when there was lots and lots of research coming out about the importance of not only prevention and promotion, making people aware of it, but also the different types of interventions that could take place. The United States, because of the FDA rules and regulations, is very slow to approve many of the options that are out there for the interventions for myopia. And once you're myopic, your goal is to slow the progression down, and you need to do that during school age. And many of the studies were not necessarily looking at those 6 and 7-year-old kids. So I was excited about the fact that these things were coming out. The NASEM report, which is the National Academy, really focused on the need to have better quality research. And you need to have not one study showing a benefit, you need to have studies that repeat it and show the same outcomes. So what was good to be a part of was watching the research grow and blossom. The other thing that was happening is there were more tools that were coming out that different corporate entities were looking at, as well as seeing the development of the Global Myopia Awareness Coalition, which, one side's the research, one side's the education and awareness piece. And to be honest, it was very clear when GMAC, which is what it's referred to, began. It's housed at the World Council of Optometry, and most of our members began as corporate entities, but now we have a lot of nonprofit associations and organizations that represent eye care providers. The goal is to be able to develop PR to share with families about the importance of watching your child for the potential of myopia and making sure you do something about it. GMAC is really an important entity. They also realized pediatricians were really not testing for it as much as they should be. Or if they did, they said, yeah, your child probably is going to be nearsighted, but they didn't talk much more about it because they're so busy. They have so much to do in those well child exams that there's just very little time to go into any details.
Right. Yeah, that's an interesting point because I never even considered my pediatrician when it comes to eye care. I remember we would grow up to see our pediatrician, pretty consistently, but eye care was never the focus because there's so much to cover with your yearly. So the comprehensive eye exam, that's what makes it so important to get done because it gives all the
Absolutely.
attention to it.
Yep. And the pediatrician wouldn't do the exam, but they would be
Yeah,
the ones that would screen for it. And I'm sure
exactly.
you've gone into the doctor's office and they have you read the letters on the wall. Well,
Yeah,
many pediatricians don't have they have the nurses do it, and the nurses are busy and they
yeah,
try really hard, and it's required for them to do it in certain visits, but it's just, it's cursory and oftentimes it's not a priority. So I think educating pediatricians is also important.
yeah.
Yeah. I think the eye exam itself, the one where you read the letters, is also funny because I know in some cases I remember, or at least in school exams, my friends who uh were myopic or had nearsightedness would ask the person in front of them what the letters were, and then they would try to memorize it,
Oh, yes.
which I think that's really funny how there's some sort of stigma behind the idea of getting your eyes screened and then having to go in for more care. I think less funny, more like intriguing and I guess sad that there's that stigma.
It is sad. There's been a real push to have stylish frames, or, there are even kids that want to wear frames that have no prescription, which is kind of interesting. You know, I fight the kids that need glasses to wear them, and then there's people who want to wear them just for it looks good.
Aesthetics.
You can't win it all, but
That's
I do think that encouragement. Siblings are sometimes the big challenges. Oh, you look like Four Eyes, the old-fashioned things that people would say. And in my family, all of us wore glasses, so it wasn't really one person could say something about the others, but there's enough teasing going on that I realize that that goes on around the world. I also think that it is important to know that not everybody has access to glasses and eye exams. People who come from families that have limited income or their insurance doesn't include vision, there's a lot of people who don't have access, and those kids may be trying to pass so they don't have to push the pressure on their parents to take them for an eye exam. So that the economics in the United States is also a bit of a challenge.
Yeah. On the topic of accessibility, you had worked with the Special Olympics Opening Eyes, and you focused on persons with disabilities. So, what should families and communities understand about making eye care more accessible for children with different needs?
So the Opening Eyes program was a program that was designed for not only children but adults as well, which
Mhm.
was really important because oftentimes, especially for lower functioning individuals, they felt glasses were just frivolous and didn't really
Right.
help. So there was a lot of education to the families of the importance of wearing glasses. if you let this child wear glasses, they may be able to learn better or achieve a higher level. So we really worked hard on that. The other problem we found is my colleagues and ophthalmologists didn't necessarily want to see kids with, or adults with special needs because it's harder, it takes a little more time, and it's not necessarily as pretty. You know,
Yeah.
some of the patients we've seen over the years have been challenging. It has been so rewarding. 25 years of working with Special Olympics was absolutely the best thing I could have ever done. I, I learned more from the athletes than I probably gave. Um, they want to see better. They want to work with you. So it's always been good. We heard of an athlete. You know, you talked about the kids asking what's going on the screen on in front of them from the person in line right before them. Well, one athlete who was very nearsighted told us about a race they ran, and they said, well, everything's a blur. I just follow the person in front of me. So they never won gold. They came through the opening eyes program. They were a very high myope. We always tried to get the glasses to the athletes before they went home because many countries, it's hard to get it to the athletes.
Yeah.
Politics, lots of things happened. But
Right.
the goal really was to make sure they got them before they went home. The athlete came back after running a race with a gold medal and say, I actually could see where I was supposed to be going. So, I mean, to me, that was heartwarming. But the goal of the Special Olympic Opening Eyes program, and it's actually called the Special Olympics Lions Club International Opening Eyes, that's our full name. And I'm not there anymore. I've retired from that. But the goal was to educate clinicians about the needs of people with disabilities and different tools to use, as well as providing the eye care and improving access on site for the athletes. So it was a combination of let's see what we can do here, but we want to make sure we can increase accessibility when they go home.
Yeah, I think it's really interesting how most, I guess, clinical professionals touch upon the relationship between patient and doctor, and how a lot of professionals actually learn more from the patients than from the doctors, which is why I was so excited when I founded Clarity Reach to get a patient's opinion out there so that people can people can know and people can learn those experiences, not only fellow professionals, but not fellow, but other professionals, but also other patients as well.
Oh, patient to patient, that peer interaction is so important. And I will say, because I worked in a community in Chicago, that young people were pretty impressive. They may not have had the million-dollar homes, but they had big hearts. They were bright, they were energetic, and they shared if they could thought they could help somebody else. So I agree with that. I found children got dilated in my clinic because that may have been their only exam for years. So we always made sure we did a thorough eye exam, and while they were dilating, it was an opportunity to communicate with them, you know, see if they had any questions, ask them what they want to do in their future. If they had a high amount of vision problems, you want to maybe guide them away or towards different things. Always talked about optometry as a great profession. There are lots of things that young people have to offer, but we oftentimes don't have the time or take the time to get that conversation going. I know this is outside the purpose of this interview, but I just think that is what really drove me. I miss that more than I miss actually providing the care.
No, I think that advocacy is so important, and the work that you've done is absolutely incredible. I mean, getting care to everyone is so, so important because everyone in this world deserves equal care. So I think that's very commendable.
Affordability, accessibility, I'm trying to think of the World Report on Vision, all the things. Equitable, it has to be the same quality of care.
Yes.
Everybody should get the same care that that doctor would give their mother.
Yes. There you go. On the topic of global care, global health, you guys have helped the WCO have helped a lot of myopia management globally. So, what progress have you seen, and where do you see the biggest opportunities to improve?
So there's a number of challenges that go along with that. Because many products are not available all over the world, the myopia management involves either glasses, and there are special lenses for myopia control, contact lenses, regular ones that are designed for myopia management and not your everyday, just correcting your vision lenses.
Yeah.
Orthokeratology, which is wearing a hard contact lens overnight. And then there's new pharmaceutical interventions that are coming out, which would be putting a drop in the eye. And it doesn't include glasses. You probably will also need the spectacles, but there's lots of options that have been created. Not all of them are available everywhere around the world, and that's been a bit of a challenge. In addition, and we learn more every day about some of the tools that are out there. Each few years, you see some improvements. We had started a group with CooperVision on myopia where we advocated for education and tools that they could use with their patients. We called them myopia management leaflets that they could share with their patients to educate them. Um, we also tried to educate clinicians because a clinician who's been out of school for some time doesn't read the research like I might read the
Yeah.
research. So our goal was to provide educational materials either through videos or online, something that they could do to learn more of what we've learned about how to intervene on myopia, that it's no longer what it was before. It is a slow process. To make changes in treatment of major diseases sometimes takes 10 years because you have to change the focus of what someone's been doing for their whole life for their patients. There are things that you think that you learned when you graduated that will be the way you practice for your life, and that is not true. Things change, new research comes out. Technology is amazing in how fast it's changing. So being at WCO, yes, we've helped educate the public and we've helped educate the clinicians around the world. We still are fighting things like scope of practice in different parts of the world,
Yeah.
access to the tools that will treat the myopia, and ensuring that it is affordable to the patients that come into their office. So those are some big issues.
Yeah. I know that even internally, getting things like low-dose atropine for myopia management is a bit of a challenge because it's not FDA approved. I know that we had issues getting his atropine because our compounding pharmacy just like wasn't working out as it usually does.
Yes.
So I think there's a lot of work to be done, but hopefully, we'll get somewhere and we'll really get that focus on this epidemic.
Fingers crossed there will be a new atropine drop available by the end of the year if FDA goes through and approves it. And then you won't need a compounding pharmacy. It will be available from your regular pharmacy as a prepared drug that will be ready to go. You give them your prescription and you walk out with that little bottle. And it supposedly has a longer shelf life, which is another problem with compounding drugs.
Yeah, hopefully we'll see.
Yes, yes, and hopefully reasonable. Their goal is that they want to make it marketable for anybody, not just people with lots of money.
Yes.
Um, yeah, so parents on the topic of atropine, I guess, parents may hear about low-dose atropine, MiSight lenses, Ortho-K, and myopia control glasses. And when you're presented with all these options, it could be overwhelming. So how can parents approach these options without feeling overwhelmed?
Well, I think the GMAC website is a good place to go for some educational information that is not tainted by corporate entities. It's
Yeah.
built by corporate entities, but it's done in such a way that it's more educational without telling you to do one thing or the other. That to me is really important. The other thing that is important is, be careful what you read on the internet. Not everything is current or accurate. And we know that Dr. Google is oftentimes used as people come into the clinic. And I love when people educate themselves, but they need to be open to understanding the facts.
Right.
And they also need to know that things change over time, as you've shared yourselves. What was good 2 years ago is not the same as what will be good next year. So it's important when people look in their search history that they look at the more current information that's present and out there. And yes, parents are great resources, but you want to verify before you say that this is what I want to do. That's with any healthcare issue. It's not just myopia. The other thing is you when you go into the doctor, you want to make sure you know what questions you want answered when you're there. So making the decision about what treatment interventions are appropriate for you and your child, knowing the child, knowing their hygiene may be an issue, knowing if they're doing sports, what kinds of daily activities are they doing? Are they responsible? Are they, it's very interesting. Young ladies, and I don't mean to be gender specific, but I find sometimes young ladies do contact lenses a little easier because they have more fine motor things that they're doing as a young child. But that may mean that if you bring a gentleman in whose fine motor skills are not as good, that you give them a little bit more guidance and a little bit more time. I'll oftentimes say to some of my high school gentlemen, we're going to try it. It may take 1 or 2 visits in order for you to feel comfortable. You can take the lenses home when you can put them in and take them out on your own. For high school students, I don't say the parents should be doing it. For
Yeah.
younger kids, you have to teach the parents. There always needs to be someone, a resource. So it's a complicated process. If you choose context, that means that conversation needs to say, who's going to teach me, the parent, how to do it as well. So it's not just what's available, but what is the process of success? How often do I need to come for follow-ups? How long will this process take? And how long is the myopia control program in effect? When will it stop? And that's a question I don't think we all know the answer to yet.
Yeah.
Yeah. I think parents have a lot of, I guess, responsibilities, obviously, when it comes to their children, not just in regards to uh like contact lenses, putting in contact lenses for their younger children, but also controlling their various factors, such as like outdoor time, screen time, who they like, what activities they do when they're out. So then my question for you would be, are there any daily habits that you would recommend to support healthy visual development?
That that is there's so many things to be able to respond to that. So the first thing is children need to be outside. One study says 90 minutes. In today's day, you're not going to have an adolescent out 90 minutes between, school and homework and friends and whether you do sports or arts or music, the day is limited. So there's no question there are some limits. For younger kids, I try to tell them you need to be outside as much as you can. So 90 minutes is the ideal amount, but that isn't necessarily always reachable. I do feel that if you are going to let your kids use the television or devices or their phones, there's so many different things that are screens these days. Make sure they're sitting far enough away. Um, we often suggest that if you put the TV on the wall, which is what most people are doing these days, you make sure the kids are a good 6, 8 feet away from there. I even like it a little further. And that's another tool to be able to find when the child's having more difficulty because
Yeah.
myopia changes. When they start saying, I can't see the TV, it sounds like it's time. And we have some fast responders where myopia you might see a child in August, and by December, all of a sudden they're showing some changes. So those are things to be sensitive to. It's not just once a year. You have to be sensitive to the child and what their behaviors are showing. I also think it's really important to limit the amount of screen time. We have when devices first came out, you'd have the screen and then you'd have a little box there and you just one screen. Nowadays, kids will have two screens for their computers, and then they have their iPhone or whatever phone they're using, and then they may have their something else sitting there, and then they'll have, they'll be reading a book and doing their homework. So all the devices are sitting there. There needs to be some control as to how much of that.
Yeah.
I am not an advocate of taking phones away during meals. I don't like to recommend rules like that. That's a parent's choice to do and
Yeah.
not the doctor's choice. But there needs to be some more interaction. That is not a vision issue. That's a social issue. The psychosocial pieces, as much as vision and eye health is usually kept separate, vision is really part of growing and developing relationships with other people. Eye contact is really good for kids to develop, especially as small children. So that's a whole different ballgame, though.
Yeah, I think it's really interesting the correlation, or I guess the relation between screen time and eye health, because in China, a lot of the things the doctors, like Dr. Hay, emphasized over there was that it's not necessarily the screen that's actually leading to the issues. It's the fact that the screen is causing children or people not to go outside.
It's an interesting perspective. I would say I would agree that that's part and parcel of it. I do think that the close demand, locking or focusing in for a long period of time is not necessarily in the best interest of a child. So I
True.
think that also is contributing. There's so much about myopia that we don't know, that the research is out there being done, and China is the place where more of it's being done on larger numbers. The larger numbers you have, the better information we're looking at. Plus, some of the groups that are doing work there are working on younger and younger children. And if we want to focus on prevention, we need to start before the myopia develops. That means the 3 to 5 year old group.
Gotcha.
Yeah, so I guess for a sort of closing question I ask this to every doctor person I interview. Uh, if someone saw this interview right now, what is one practical action every parent should take this month if they just saw this interview to better protect their child's vision?
So the first thing I would do is if they haven't had an eye exam and they're in school, they need a full eye exam. Not a vision screening, but a full eye exam just to make sure everything is healthy from the front of the eye to the back of the eye. The eyes are working appropriately so that the child can go into school and function at the highest academic level they can. Not talking about behavior issues, we all know kids like to sit, some kids like to cause trouble. When they have a child who's showing performance that is insufficient to their belief of what the child's capable of, another good reason. Let's rule out a vision problem, and that would be really important. So it's awareness of their kids, the kids' needs, and what they could do to help the kid succeed at the highest level possible.
All right.
Yes.
Well, that's about all we had in the meeting. Like, hopefully we don't get kicked out. So, um, thank you so much for all of your input and your time. We learned so much, and we really, really appreciate everything that you've done today. We really, really appreciate it.
Yes, thank you so much for giving us the time.
Oh, well, thank you for even asking me. When you get to this end of the continuum of age, you're happy a young person cares what you have to say.
No, it was amazing. Thank you so much for everything. We will definitely take this info into account when building our website and our interviews.
Keep in mind, vision care is pretty wonderful, whether you want to be an optometrist or an ophthalmologist. It's great, and kids are wonderful to work with.